Thank you. So it's freezing cold in here. There's food on the way. It's after 5. I know I'm going to have your undivided attention, but thank you for sticking around and listening. So my work mainly focuses on individuals with intellectual and developmental disabilities that are around 21 or children. So the person who is our expert on this is in Europe right now. If you have questions, I will make sure those get answered. Whether I will be the one answering them right here, right now is up in the air. So most of you are familiar with what TJC does, but just so you know, it's a nonprofit law firm here in Middle Tennessee. We do trainings, we do direct client work, and we have an advocacy team that mainly focuses on expanding Medicaid, but also picks up other issues that our client advocates bring to the table that they've seen through their direct work. So today I'm going to talk a little bit about home health services generally, TennCare and Medicare home health services, and how you become eligible for those, what's available, what are the caps, and then some major issues that affect how our clients can get those services. So home health services are available to those who need assistance with activities of daily living that Chris and Shelby just covered. They're available to those who need help with an illness or injury in their home. That would be Medicare. And those who need home health nursing services. So with TennCare, individuals might think of choices first and foremost when they think of home health services, but they are also available through TennCare Medicaid and Standard, as well as ECF CHOICES, TennCare's new program for those with intellectual and/or developmental disabilities. And choices is for those 21 and over. I know some of you probably are experts on this in this room, so just bear with me, but it's also for those who are over 65 who need assistance with ADLs, and they need the care in a nursing home or in their home, depending on what their needs are. I'm also going to talk a little bit about Options, which is a state-funded program created to provide older Tennesseans and those with disabilities home and community-based services. What's different about Options is this is not just for low-income individuals. This program is based, it offers a sliding scale payment, and there are only 3 services available for home health. It's just a more limited program. And with Medicare, Part A and Part B can cover different home health services, and those are mainly available for someone who needs a skill. And I'll go over more in detail what that means, but you need to require a skill in your home in order to access home health through Medicare. Generally, determinations in all of these programs are based on what your doctor says you need, the amount and duration of the services you require, the skill level required to give you that service, and the availability of your natural supports, which is a term I will define later. There's different eligibility requirements, as you all know, and there's a lot of different assessments to make these determinations. So for TennCare, like Chris covered, in order to access the care, it has to be medically necessary. This dictates what services you can access. It dictates how many hours of the service you can access. And TennCare will usually send out a nurse from the MCO to determine how many hours you need. So one tip is to make sure you acquire and create records, especially based on the assessments that are being done in your client's home. I had a client who required a lot of services, and they frequently came out and did assessments. And one of those times, it was about 3 hours, and they went through every single service that this person needed. And at the end, they said, you need too many services. That's over 24 hours, so you need to change your answers. And she did. And then she got a letter that said she was being cut. Some of her hours were being cut. So make sure you tell your clients not to change, not to say things that are not true, but to truly go over every single need that they have, not change their answers, because that is something that happens, unfortunately. So it's really important to make a record or be present when those assessments are being made if you have questions about whether that person's going to be able to stand up for themselves. And the more needy someone is, the more skilled services they need, the more important that is. So the 5 prongs of medical necessity, which I know you're all familiar with, has to be recommended by a physician. So this has to be someone who's licensed and is currently treating the client. This was specifically with TennCare. Has to be required to diagnose or treat a medical condition, and specifically with home health aid services, I'll mention here that on top of what Chris already covered, these services have to be of a type that the enrollee cannot perform themselves, that for which there is no caregiver available to provide the services already, and that consists of hands-on care. So there are added requirements for a service to be required to diagnose or treat a medical condition when it comes to home health aid services with TennCare, and there are other services that have specific additional requirements. And it is really important to note that the convenience of the enrollee or their family or caregivers or providers are not considered when TennCare is making these decisions about whether care is safe and effective. That's really hard for a lot of clients to understand, because based on common sense and logic, you would think that someone is not able to provide a certain number of hours of care to their loved one and also have a job and also sleep and take care of themselves. But this is not something that is put into this determination. So we're talking about TennCare natural supports. This is something that they will ask you about during the assessments. So friends and relatives who provide unpaid help are considered someone's natural supports. It's really important to make a record of what those person's limitations are. So if they have a job, if they live nearby, how often they're able to go into the home of this person. Those are really important because you'll need to present those limitations pretty quickly when these assessments are being made. And if someone has already been providing a service for somebody for free in their home, TennCare will ask about that, and they will use that as a way to either decrease services or just not offer as many services as that person would like to receive. So talk to your client about who's been giving them services, what have they been doing for them, and what that looks like, so you can better present that when they're being assessed. So to receive home health services through options, you must be a Tennessee resident, 18 years old, and meet the ADL and IADL limitation requirements. As I mentioned earlier, there's no income limitation. There's no one is excluded based on their income, but they will be paying based on a sliding scale fee. And there are different resources online for how to apply for that, but you can call your AAAD if someone's interested in those services and you can't find something for them, maybe in Medicare or TennCare. So for Medicare, they will pay for home health if you are under the care of a doctor, you need a service that requires a skill, and you're homebound. A side note, the agency also has to be approved by Medicare specifically to provide the services to be eligible. But what under care of your doctor means is you must be getting services under a plan of care that doctor has reviewed and be regularly seen by that doctor. And you must need services that require a skill. This means is you must have a need. You must need a skilled service from a nurse or therapist in order to be eligible for home health through Medicare. So some of those services are intermittent skilled nursing, physical therapy, speech language therapy, continued occupational services, but that is kind of the door that opens the opportunity for you to get home health services through Medicare, requiring one of those skills. And homebound, it's really hard for most people to understand exactly what that means when they're trying to determine whether they qualify as homebound or not. But it means that leaving your home isn't recommended because of your condition. It's someone who has a normal inability to leave, and it's a very taxing effort to leave their home to go do things. However, just because somebody has infrequent trips or absences to the doctor or a religious service, that does not disqualify them. So they can still go do those things and be considered homebound. So there are services available based on your skill level that you need and based on the program that you require. One thing I'm going to add here, it doesn't really fit in, but I was doing a different presentation in Chattanooga last week, and someone came up to me and said, I didn't know this. I've been working with individuals who need home health for a long time, and you can call your MCO. You can call and request a different MCO whenever you want. The reason this is so important is sometimes there are different things available based on just who your MCO is. Maybe there are extra supplies that are provided. So her example was with incontinence care, she called and requested to be changed to Blue Care, and they provided gloves and other things that were not provided through the other MCOs. So just keep that in mind. That might be a way to find someone the little bit of extra help that they need if they can't afford those supplies, or it's very difficult for them to leave the home and go obtain those. So through TennCare, we can get part-time or intermittent nursing services and home health aid services. And when I say TennCare, I'm talking about TennCare Medicaid, TennCare Standard, not Choices. But it must be ordered by a treating physician and pursuant to a plan of care. This does not include general child care, cleaning services, meal preparation, or services for any other household member. So the limitations on part-time or intermittent nursing are you cannot get more than one visit per day. That visit can only be up to 8 hours, and then 27 hours is the max for the entire week. So that's the only way you can be considered to be someone who needs part-time or intermittent. If you need more than that, you're not going to qualify for the service. And if more than one person in your home needs those services, then one nurse might be able to come out and they can provide services to both individuals depending on what their needs are. And I'll talk about private duty nursing here. It doesn't come up a whole lot because it's really, really hard to get this service if you are 21 or over. The requirements are you have to be very, very medically fragile. And what that looks like is you need to be on a ventilator with an invasive patient end of the circuit at least 12 hours a day, or you need to be ventilator dependent at least 12 hours a day with a progressive neuromuscular disorder or spinal cord injury. And that can be a non-invasive patient end, but still at least 12 hours a day. Or if you have a tracheostomy and you require suctioning, oxygen, and you need your medications and nutrition delivered to you through a G-tube, and there's some very specific rules. Those are the only 3 ways you can even qualify for 1 hour of private duty nursing if you are 21 or up. So it's really important to remember when people turn 21 or they have a child that's turning that age, things change a lot, and that service is just really hard to attain. So for TennCare home health aid services, those include assistance with activities of daily living like mobility, toileting, and transferring. You can only get up to 2 visits per day for assistance with that, and each visit cannot be more than 8 hours. If you're receiving part-time intermittent nursing services and home health aid services, because the one is skilled, one is not, you can only get 8 hours a day total of both of those services combined, or 35 hours a week. That's the max. However, if you qualify for level 2 skilled nursing care, you can get up to 40. That would be the absolute maximum for both of those services. And someone who qualifies for level 2 skilled nursing care is someone who requires skilled nursing or rehabilitative services on a daily basis, or skilled rehabilitative services at least 5 days per week. So through Choices, home health services include attendant care, companion care, homemaker services, in-home respite, and personal care. Personal care is short visits. They're usually no more than 4 hours. It's when someone will come help a client do things like get out of bed, take a bath, get dressed, fix and eat meals at their home, use the bathroom. Attendant care is the same kind of help, but this is that someone would get with personal care visits, but this is for longer periods of time. In-home respite is when someone will come stay in the home to relieve a caregiver. And companion care, this is when you can hire someone to come live in your home to help provide personal care and homemaker services to you whenever they are needed. But this is only available through consumer direction. That's just a different service delivery method that I'll address a little bit more later. That's the only way you can access companion care through Choices. Some of the other services that are available in the home through this program are home delivered meals, personal emergency response system, different assistive technologies like a grabber if you're unable to get up very easily, minor home modifications, and pest control. So through ECF Choices, Employment and Community First Choices, the home health services available are personal assistance, respite and supportive home care. Supportive home care is only for those in a specific group of ECF that have to be aged under 21, so I won't go into detail on that one. But personal assistance, it's the same kind of care as in Choices. It helps someone with their personal care needs or daily living activities in your home. This can include household chores or errands, but only for the person that is designated as the recipient of those services. No one else in the home can be supported in that way. And then respite, it's the same as Choices, can relieve a caregiver, provide that care for an individual, but this is only for routine family or other caregivers who are not paid. They can't relieve some other paid caregiver. And the services available through Options, the other state-funded program, are homemaker services, personal care, and home-delivered meals. Again, those specifics, you can call the AAAD and ask for more information. They also have a statewide toll-free line you can call or give that number to your clients. So with Medicare, they cover a wide range of services to treat an illness or injury. Those services include part-time or intermittent skilled nursing care, home health aid care, physical therapy, occupational therapy, speech therapy, and medical social services. But Medicare will not pay for 24/7 care in someone's home. That is something they will never cover. And they will not deliver meals to your home. And they will not provide other homemaker services like shopping and cleaning and laundry. And you are not eligible for the home health benefit if you need more than part-time or intermittent nursing care, because they don't provide that 24/7 care. If you need beyond their limitations of part-time or intermittent, you're not eligible for that service. They can also provide home health medical supplies in your home or help you with dialysis. That's something that people can get in their home if they're able to use the equipment and are eligible for that. So something to keep in mind if someone needs some form of supply or has a need that they can address alone in their home, especially if they can't afford transportation or it's very difficult for them to get rides. This is a good option to look into. And medical social services, this is a standalone service. You cannot access this unless you need a skill. So unless you have someone coming into the home like a therapist or a nurse to provide some other service that's needed, you can't get the social services along with that. Medicare defines their skilled nursing as a service that must be provided by an LPN or RN for a treatment of illness or injury. TennCare is more, they allow other people to provide these kinds of skilled services in certain circumstances, like through the ECF Choices program. We have clients who are receiving personal care and they can get skilled services that way. So Medicare defines it differently. And an exception is that they cannot provide a service that can be done safely by a non-medical person without nurse supervision. I do not know exactly what that means or what would qualify as being able to receive that service safely in the home, but that is a reason that they can say someone's not eligible. This includes giving IV drugs, shots, tube feedings, changing dressings, teaching someone about prescription drugs and diabetes care. And the limitations on this one are no more than 8 hours a day, 28 hours a week, or 35 on a case-by-case basis if you have a high level of needs. For home health aid care through Medicare, it is covered if you have a skilled need, such as the skilled nursing, PT, speech therapy, and hands-on personal care services are needed to maintain someone's health or facilitate treatment. This is for needs like bathing, grooming, assistance with medications, and incidental services such as laundry or light meals can also be provided by home health aid. There are many different caps on services. There are program caps, service caps, and different caps based on how you're receiving the service, whether it be through a consumer-directed option or through an agency. And with choices, the home health services that are the limitations that I addressed were for personal care, 4 hours per visit, 2 hours a day, and 4 hours between visits. So those visits can't be back to back. With attendant care, up to 4 hours per visit, 1,080 hours per year, unless you need homemaker services as well, which are the unskilled needs. Then you can get 1,400, and then in-home respite care, 216 hours per year maximum. Within the ECF Choices program, with personal assistance, you can get 215 hours per month. Respite, you have to pick one of these two. It's either up to 30 days per calendar year or 216 hours. You have to choose before you start receiving that service. And you can only get hourly respite through the consumer-directed option of service delivery. And then supportive home care, like I said, this one is for individuals who are under 21, but they can't receive that service they can't receive it beyond the value of $15,000. With Medicare, their cap on intermittent skilled nursing care is 8 hours per day, 28 hours per week. And then here are the two major issues we see if people are trying to obtain these services that are affecting many of our clients. One is consumer direction, which can be a really great option for a lot of people, and a not so great option for certain people, and I'll address that. And then also, like Chris talked about, the caregiver crisis, which is causing a lot of staffing problems and other related issues. So consumer direction is just another way of receiving services. This gives someone more control over how they get the service and who provides them with that service. So it goes by a bunch of different names. In Medicare, self-directed care, consumer-directed care. There are some important things to consider for your client before they decide if this is the best option for them. One is, do I have to receive my care through consumer direction? We have people who come to us and that's kind of been the only option presented to them. So the answer is no, it's optional, and you can opt out of it at any time. If you've enrolled in it, you can get off of that track if it's not working for you, but it is optional. The second thing to consider is, what services do I need? Does this client need? The more services somebody needs, the greater the skill level that's required. So if someone needs a lot of nursing care, it makes this option a little bit more harder to attain and manage. Then the amount of services needed, that is for the same reason. With consumer-directed care, you're doing all the things that the agency is normally doing with hiring, firing, locating workers. So it's a lot harder the more services you have to make sure all those times are covered. And then, why am I considering this service delivery method? If you have a client who needs one home health service and they have a caregiver in mind, they want providing that service for them, this is a great option. If you have someone who's difficult to work with, maybe they really only like receiving care from a certain person, this is a perfect option so they can have the power to hire that person, pay them themselves, and keep that person coming in their home without the agency changing caregivers or being in control of their service delivery. And if you're considering this option, someone that has a lot of skilled needs, if you're looking at it through the ECF Choices program as a way to get more care within your expenditure cap, this might be a lot more difficult for you to work out, because it's often illusory too. When someone is wanting to get a lot of this skilled nursing care in their home, consumer direction says, we'll give you the ability to do that, and here's your expenditure cap. You can decide how much you want to pay them, and you can only get up to this much. But they're not guaranteeing someone's going to show up to the home, and they're not guaranteeing you're going to be able to line up everybody to provide that service, and they're not guaranteeing that you're going to be able to be the employer and do all of those responsibilities that go along with being an employer of your caregivers. So if someone's talking about wanting to just fit as many services as possible through the consumer direction program, make sure that they have the people that have agreed to provide that service in the home already, that are willing and able to do so before moving forward. And then, can I manage the additional responsibilities? In consumer direction, the client or their chosen representative has to become the employer of these caregivers. And so they have to be willing and able to fulfill all of those responsibilities of the employer. So some of the pros and cons of this are: the pros, they have more choice and more control, which means more independence. And for a lot of older Tennesseans, that is really important and can give them a sense of power and control, especially if someone's coming into their home. So that can be a great option for them. And it's cheaper in some programs because you eliminate the overhead costs. With choices, that's not relevant, but with ECF choices, that is. And some of the cons are: there are different limits and caps on services if you receive it through consumer direction. There are many additional responsibilities that I'll cover a little bit more in detail. The process to set it up can be long, depending on how many services someone needs. And then there are staffing issues related to the caregiver crisis. So through choices, the services you can get through the consumer-directed option for home health are personal care, attendant care, in-home respite, and companion care. That's for Group 2 members. And then for ECF choices, the home health options for consumer direction are personal assistance, supportive home care, hourly respite, and community transportation. And the caps on these services vary by the programs. They're hourly, they're monetary, so it's really important to look to see what's available before going into that option with one of your clients, because there are different limitations than are generally in the programs. So I wanted to touch on the additional responsibilities of this individual or their representative that they have chosen. The TennCare rules lay these out. The choices and ECF choices rules, we'll talk about them, and Medicare rules might be a little bit different, but I'm talking specifically about TennCare. So this person will be responsible for finding, interviewing, hiring their workers, defining that person's job duties, training them to deliver the services in a way that they want them to be delivered within the confines of the rules, setting up the schedule for all of those workers, supervising, evaluating how they're doing, developing a backup plan to make sure that that care is provided, or they have something they know they're going to do and someone doesn't show up, or there's a missed shift. And they have to stay within the service limits and budget too. That's just a few. There are many more listed, and some of you might be really familiar with that. But in the TennCare risk agreement, it's over 600 pages, but on page 212, they talk about what the fiscal employer agency must do on an as-needed basis. These are not laid out in the TennCare rules, but it says that the FEA, which is the one who provides the money to the person to pay these workers, has to, on an as-needed basis, assist in locating and recruiting workers, assisting in identification and training of these workers, assist them with job descriptions, interviewing, and that's just to name a few. So just know that the risk agreement does say that on an as-needed basis, they can ask for help with these things, but they're just not in the rules.
And did you say that's under the risk agreement for the choices? It's a choices risk agreement?
It's just the general TennCare contractor risk agreement, and so it covers choices, ECF choices, and just general TennCare services. So take a look at that. If you're wondering if someone needs help and they're in this program, that can offer you some more support. And I've had clients who want to receive services through consumer direction who didn't have everyone lined up, but they really wanted more care. They were told, I had one person that was told to just put an ad in the local newspaper, one that was told to go to care.com. So this can be really difficult for some folks, and just be aware before making that decision. And just know that someone can have their representative do this. The person's representative will take on those employer responsibilities for them. But they have to be someone really dependable that knows the client really well and knows what their needs are. And they have to be at least 18, willing and able to complete all the tasks that are required of them, They have to live with or be present in that person's home often enough to supervise the staff. And they have to sign the representative agreement. And this person cannot be paid for these services. They can't be paid for providing the services if someone doesn't show up, and they can't be paid for providing these services as an employer of the caregivers.
Is that the provider agreement that they can't be paid?
Yes. And this relates to a lot of staffing issues because there is a caregiver crisis, and I'll go into more detail with that. But right now, agencies are having trouble staffing services, and we know that. And with consumer direction, they don't have the liability or responsibility, for the most part, to make sure someone's showing up. So keep that in mind. And now on to the related caregiver crisis. So the number of Tennesseans over 65 is going to, or is expected to double by 2030. That would be 1.7 million people who are likely going to need services. About 70% are expected to need long-term services and supports. That's a lot. And we know that agencies are having a difficult time. I had someone that works at an agency tell me that they posted an ad for 2 months and they received 4 applications, resumes. One of those people was qualified for the job and they did not show up for their interview. So it's really difficult to attain direct care services. And it's a very difficult job, and I'll go more into detail, but a lot of these people, their family is going to be the one that's taking on these responsibilities. And that's just really not a good option for older Tennesseans because they might be outliving those who are closest to them. They might outlive their friends, their spouse, and they might not have any other family to take care of them. An additional issue that affects the caregiver crisis is the hourly wage. If you can see at the very bottom, Tennessee is the lowest. So we pay caregivers the least, which definitely does not incentivize people coming into this type of employment. TennCare reimbursement rates are similar to those in other southern states, but providers have emphasized that the compliance costs are significantly higher in Tennessee, and that reduces the money that's available to pay those direct care providers. They also face the challenge of fighting for and retaining those caregivers against fast food places and similar businesses because they're paying higher wages. And just as an example of just how bad this can be, vet technicians make on average $5 an hour more than direct care workers. So we pay people $5 an hour more to take care of our cats than our mothers, and that's a problem. Some additional challenges can be the benefits. Only 1/3 of direct care workers are employed full-time, and 40% of direct care workers are on Medicaid themselves. So this is a job that is not only difficult, low paying, but these individuals are having a hard time and are not incentivized to stay in these positions long if they have other options. There are also unpredictable work schedules. I know if you've had a client who had to be institutionalized or had to go to the hospital, someone who is coming into their home isn't going into their home when that's happening. So they might be reassigned to someone else, but that's another reason that it's really hard for people to stay in this position. There are also a lot of on-the-job injuries. There are actually more injuries in direct care providing than in mining, oil, and gas extraction. And there are also new restrictions on legal immigration, and 1 in 4 direct care providers are immigrants. The way this can affect individuals who are receiving services are they can have a hard time finding workers to come into their home. There's a high turnover rate, and missed shifts, like Chris said, are so common. It was shocking to hear that there were only 8 appeals, I guess, filed regarding that issue, because I know I've had clients who have had way more than 8 just themselves. And so if we make a record of that, at least if they're not, fining and getting liquidated damages from the provider who's not actually providing services, at least the comptroller will understand that this is a serious issue, especially in our state. Workers are often undertrained. The federal regulations don't require a whole lot of training and a whole lot of hours, before providers or direct care workers can come into the home. And another way this affects individuals is needless institutionalization. I had a client who could not access or guarantee the care that she needed in her home, and they would not let her leave the facility because there were so many missed shifts. They couldn't get the schedule together for the direct care workers. And so she stayed longer in a facility than she would have had she had that lined up and guaranteed for her safety. And that is all I have for you today. So if there are any questions, feel free to ask them or come talk to me after. And I'm definitely happy to send this PowerPoint with my notes to you all. I know it's different than the one you have printed, so I can send that to you if you just want to give me your email.